In this week's muscle breakdown, I'm going to be covering a very important ligament associated with hip pain, the posterior hip capsule. What's up, everybody? Dr. Matt Maggio here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we teach massage therapists a new treatment method that focuses on working smarter, not harder, allowing them to make well over $100,000 per year with less than 20 hours per week in the clinic. No gimmicks, just results. This week's muscle breakdown, I'm going to be covering not a muscle, but specifically a ligament, and it's going to be the posterior hip capsule ligament. It is very important in overall stability, function of the hip, and it gets missed a lot in a lot of hip injuries. The hip capsule sits on the back part of the hip, and it's basically like a ball of yarn that kind of opens up, and over time the hip capsule gets really beat up and it can't open how it should, so it causes the muscles around there to have to work a lot harder, puts a lot of pressure and just overall squeezing on the hip joint itself, so it can put pressure on the labrum, the joint itself, and it also causes other muscles like the adductor to have to work a lot harder. And a lot of times when clients come in and they're complaining of like a pain like deep inside the hip on the front part there, most practitioners think that that's actually a hip flexor problem, but it's not. It's actually a problem with the hip capsule, and this is something that can generate a lot of pain and cause a lot of dysfunction. In this video, I'm going to include a couple of things from some of our training seminars in the Peak Method. The first one I'm going to go through is a very advanced palpation of finding the hip capsule and going through landmarks and how to find it, because I always say if you can't find it, you can't fix it. And then I'm going to end with a treatment demonstration using manual scar tissue treatment to break down scar tissue in that capsule, increase range of motion, decrease pain, and increase overall functioning. So first we're going to start with the palpation, then we'll go right into the treatment. The next thing we're going to look at is the actual hip capsule itself. So it's a ball of ligaments that comes back and it goes through here. And a lot of times that gets loaded up with a lot of scar tissue. When it gets a lot of scar tissue, it can't lengthen how it should. And a lot of people will get some pain out in the hip. They'll even get some swelling when this is causing a problem. So this one, what we do is we roll up to really expose that. And then what I like to do is put the hip in a little bit of flexion just to let it slacken. And then we get in here and we landmark as we do. So first thing I find is the 𝘏𝘪𝘱 𝘍𝘭𝘪𝘗, and you can't miss it. It's right through here. And then what I find is the back part of the 𝘍𝘭𝘪𝘗. Right here, I'm still hitting on bone. And the next thing that we do is we pick up our thumb and go just in like that. Now we're able to really sink in and get on that hip capsule. It's right underneath there. And the way I get my palpation is I come in with this hand and back it up, and then my drive is to come in with this hand, and then I tension it with that hand. So drive comes here to palpate, and then here, and then you're feeling if that is really jammed up. And this area is so important and so dysfunctional in a majority of hip problems and hip cases. The problem is people don't actually get on it. They're either too close to the bone or they're out in the lateral part where the sciatic nerve and the superior gemellus lives. It's right in between there, and opening up this hip capsule can make a big difference. So that's a functional assessment for the hip. Now we're going to get in here and treat the hip capsule. Once you've cleaned up the adductor, now the hip capsule is very important. Now, the key is actually the position of the client. You want to have them stacked up just like this, and you actually want them to scoot towards the bottom of your table on the very edge. So come down just a little bit more, and they'll be set up just like that. And what you're going to do is take this back leg and let that go here, and the leg is going to rest right up against the table. Now the motion here is the client is going to start by keeping their leg on the table, and they're going to slowly bring that up through here, and you can even have them reach down with their other leg behind the hamstring and finish off the rest of that motion, because we're going to get what's called hip flexion to open up in there. So what we're going to do is have the client move up like that, and then when it gets close and they can't go any further, they're going to reach under with their hand and pull their leg up to finish off the rest of that motion, because we want to get full flexion in here. This is the test that we're fixing. Now, watch the palpation video in how to get on the hip capsule. If you don't get on it, you can't treat it. Now, the key here is actually your body mechanics and how you approach it. So anytime you're treating the capsule or the lower part of the hip, you want to approach it at about a 45-degree angle to get that to open up. You've gone through the palpation to find that. So you found the greater trochanter, you found the backside of the trochanter, you sink in just like that. And that's right where that hip capsule lies, and you found it. I've already taken the client through the motion so they know what the motion is and they know how to do that. Always check with them to make sure they have it right. Now the key here is going to be your body and how you set up. So what I like to do first is I just have my thumb nice and relaxed in here. And come over a little closer. I have my thumb nice and relaxed in here, and then I'm going to back it up with this other thumb. And essentially what we're going to do is we're going to get some depth in here, and then we're going to get some tension on that as well. So to start, you're going to line up right over top of it, and I get a nice wide stance here. That allows everything to relax. And what I want to do is have my arms nice and straight, and I'm going to lean in with my body. That lean in is where you're going to get your depth. And for the capsule, you want to get more depth. So you're going to push with this arm just like that, and then your tension is going to be a counterclockwise kind of lean like that. You're going to hold that, and the client's going to start to do that motion. Go ahead. And it'll pull right away. And you're going to stay right over top of it, just like that. And they're going to open that up. So like we said, the key is getting your body over top, and I'm very strong in here. I'm up on my toes, and I sink in, and you'll see my elbows start to bend as I sink in. And once I do that, I push in with the other hand, and then I get my tension with almost a lean, just like that. And the client goes ahead and moves, nice and slow. And when this is bad, it's bad. They're going to finish off that motion. You're going to hold it at the end for a count of maybe 5 or 6 seconds. Now the key, I want you to see this. Come a little bit closer. I want you to see how my feet are. So the key here is a couple things. As we're sinking in, I'm getting my depth by going here, but my tension is actually a pivot with my feet. So I'm here, and I pivot like that. And as the client moves, go ahead, I'm going to kind of go around and go here, because the whole time you want to keep your sternum over top, because that's where you have your power. So you want to kind of track with that as that goes. So it's kind of a shift in here. And a good way to practice that would be in the morning when you're doing one of your warm-ups, and you've seen that video. We'll practice that as well. That's going to set you up for sciatic nerve and for capsule. So I hope you got a lot out of that video and learned something. If you like the video, give it a comment, a like, or a share. If you got any specific muscles you want us to cover, send us a message. We're always here to help. Go get our free training. Follow us on all the socials, YouTube, Facebook, LinkedIn, and also subscribe to the podcast. And lastly, our 2022 seminar schedule just came out, all CEU approved. Come take one of our seminars and really get on that level from becoming a service provider to a solutions provider. Appreciate you guys watching, and I'll see you on the next one. Bye.